So in today's video I am going to discuss about the chronic bronchitis. So first of all I am going to discuss about the causes of chronic bronchitis. Next, pathogenesis of chronic bronchitis. Third, microscopic features of chronic bronchitis. And the fourth, clinical features of chronic bronchitis. And the fifth one is the definition of chronic bronchitis. All these are the main parts of chronic bronchitis that I want to discuss today. So let's begin. So let's first begin with the causes of chronic bronchitis. Now I am going to discuss the causes of chronic bronchitis. The first cause is just smoking. That is, in smoking, as you know, that carbon monoxide and nitric oxide, all these harmful chemicals are present, and all these harmful gases or chemicals, they cause chronic bronchitis. So the first cause is the smoking, and the second cause is the air pollution, and the third cause is the air pollutants which are released from plastic factories. So this occurs in the persons who mainly work in the plastic factories. And also fourth one is just infections from bacteria, virus and mycoplasma. So these are the causes of chronic bronchitis. And since like the harmful gases present in smoking or the harmful gases present in air pollution, bacteria, all these are the agents which cause chronic bronchitis, and all these agents are considered as irritants because they cause or they are responsible for chronic bronchitis. So friends, so see this histophysiology of trachea and bronchi. So if you see this, so you can notice that these are the pseudostratified ciliated columnar epithelium, and these are the goblet cell, and this is the submucosa, and in this submucosa smooth muscle present, and here mucous gland is present and serous gland is present, and this is the hyaline cartilage. So this is the normal histophysiological structure of bronchi and trachea, and you can notice that in this normal histological structure the number of a mucous gland is not very high, and also there is a number of goblet cell is also not very high. Now so this is a normal structure of trachea and bronchi. Now see that. So the irritants are there, and these irritants are lead to chronic bronchitis. And how this is caused? So here you can see that in the now in this histopathological structure of trachea and bronchi, the number of mucous gland is increased. See that. So initially only three are there, but see that now as compared to previous one, that is it is 7. So therefore there is a number of mucous gland has been increased. So this is the first histopathological structure, and also you can see that a number of goblet cell is also increased. And how this number of goblet cell increased? That some of the here pseudostratified ciliated columnar epithelium converted into goblet cell. So this is the main pathogenesis. And as you already know that this mucous gland here produces mucus. So due to increase in this mucus gland also, you can notice that the hypersecretion of mucus occurs, and due to this hypersecretion of mucus, that is the air pathway is blocked, and due to this blockage of the air pathway, that is a bronchitis is caused. So this is the main pathogenesis. So see the pathogenesis. So here all the irritants which I have discussed. So if you want to know what are irritants, so simply like that, all the harmful gases which are present in smoking, air pollution, and also basically that this positive bacteria, viruses, mycoplasma, and all these pollutants of plastic factories and of cotton mills, so they cause here chronic bronchitis. So they are caused or they are known as irritants. And so how this is done, you can easily relate with the help of the microscopic structure. So see the other irritants are there, and these irritants here cause hyperplasia of mucous glands in trachea and bronchi. Hyperplasia, that means increase in the number of mucous glands, as you have noticed. So due to this hyperplasia mucous glands in trachea and here principal bronchi, automatic hypersecretion or over secretion of mucus production done in the lumen of the bronchi and trachea. Now, as a result, that is the lumen of trachea and principal bronchi block, and due to this blockage of lumen of trachea and principal bronchi, so here that is obstruction of airways occurs. So this is the main pathogenesis. And also, so here causes if you want to know, so therefore smoking, air pollution, infections of bacteria, virus and mycoplasma, and pollutants of plastic factories and pollutants of cotton mills. All these are the causes, and in this, so here, and all these substances or chemicals which cause chronic bronchitis, they are known as irritants or causative agents. So I have discussed causes of chronic bronchitis and also pathogenesis. So now let's discuss again the microscopic structure. So now discuss about the microscopic features of chronic bronchitis. But before knowing the microscopic features of chronic bronchitis, just you should know about what is metaplasia. So now see that, see this diagram. So by seeing the diagram, you can relate that one cell is converted to another type of cell. Now, and this metaplasia, it is a process by which one cell is converted to another type of cell in response to any physiological or pathological stressful condition, and that process is known as metaplasia. I read that. So here that is about metaplasia there. So here that is metaplasia. It is a process where mature cells got converted to another cells in response to a stressful condition, and that process is known as metaplasia. So just remember this. So this is a normal histophysiological structure, but now let's discuss about a chronic bronchitis histopathological structure. So the first thing, as you can already notice, that we compare to the normal histophysiological structure of trachea and a principal bronchi, so here you can notice that the number of mucus gland has been increased. See, and also you can notice that earlier the number of goblet cells is only 2 or 3, but now the number of goblet cells also has been increased in chronic bronchitis. And how this is done? Now here see that, so these are the pseudostratified ciliated columnar epithelium. Now due to that stressful condition caused by the irritants, that some of the pseudostratified ciliated columnar epithelial cells get converted to goblet cells, and therefore that is, you can notice, metaplasia of goblet cells. So see that some microscopic structures. So first, increase in the number of mucus glands in submucosa, and second, some of the pseudostratified ciliated epithelial cells got converted to goblet cells, and that process is known as metaplasia of goblet cells. So these two things that you have to mind. And also that this increase in the number of mucus glands is also, that is a process or a, that is response to the stressful condition caused by the irritants, and this increase in the number of mucus glands with response to stressful condition caused by irritants is also known as hyperplasia. So now let's discuss about the clinical features of chronic bronchitis. The first clinical feature is the persistent cough. So now I'm going to discuss what is the cause or the region of this persistent cough. So friends, as you already know that in chronic bronchitis, due to irritations, that excessive mucus production done in the lumen of the bronchi and trachea. Now, and you know that this excess mucus not required by the body. So therefore the body tries to get rid of this excess mucus. Now, in order to get rid of this excess mucus, the body does coughing so that this excess mucus can be get expelled. So this is the reason why a persistent cough occurs. The main reason for the occurrence of persistent cough is that the excess mucus production done due to the irritants, and this excess mucus production try to get expelled by the body through the process of cough. And also in some patients also throat clearing occurs. So this is the main reason of persistent cough. Now let's discuss about a second clinical feature. This is the dyspnea, and dyspnea, that means it is the difficulty in breathing. Now you can relate, as you already know that in case of chronic bronchitis, we compare to the normal, the lumen of the trachea and bronchi is narrowed, or you can say blocked or obstructed. Why? Due to the excess mucus. Now as a result, the air pathway is also obstructed, or it is also affected, and due to the affection in this air pathway also, that is breathing difficulty occurs. Now the third one is the cyanosis. Now what is cyanosis? When less oxygen supplied to blood and tissues, and that condition is known as cyanosis. Now you can easily relate how this cyanosis occurs. As you already know that this breathing difficulty occurs, that means less oxygen captured by the oxygenated blood. So here oxygenated blood present in pulmonary vein. Now if less oxygen captured by the oxygenated blood, and automatically less oxygen will be supplied to the tissues, so therefore cyanosis will occur. Now and the fourth one is the recurrent infections from bacteria, virus and mycoplasma. And the fifth one is the right-sided heart failure, and the enlarged heart site observed in radiology or X-ray. Now I am going to explain the reason for a right-sided heart failure with the help of a diagram. Now, but before knowing this, just see this diagram. So by seeing this diagram, so you can relate the pulmonary circulation and systemic circulation. So now I want to discuss you about the right-sided heart failure. So just only remember and see the function of the right side of the heart. So if you see the function of the right side of the heart, you can relate that this right atrium, so here receives deoxygenated blood from vein, and then this right ventricle transfers this deoxygenated blood from heart to the lungs through the pulmonary artery. So the main function of right ventricle in this case is to transport deoxygenated blood from heart to the lungs, and then in lungs, that is this deoxygenated blood, so here comes in the pulmonary capillaries for gaseous exchange. But this is the main function. Now see this diagram. So this is the here right chamber of the heart, which contains right atrium and right ventricle. So right atrium receives blood from deoxygenated blood from superior vena cava and also from the inferior vena cava. Now this deoxygenated blood goes into the right atrium, and then this right atrium, so here pumps blood. So this deoxygenated blood goes into the pulmonary artery. So here it is a pulmonary artery from the right ventricle, and then this deoxygenated blood goes and through pulmonary artery it goes into the, so here that is lungs for the gaseous exchange. So this is a normal situation or a normal phenomena. Now in case of chronic bronchitis, what happens? As you already know that in case of chronic bronchitis, that is the lumen of the airways of lungs is blocked, or it is narrowed or obstructed. Why obstructed? Due to excess mucus production. So in case of now chronic bronchitis also like that, so that a deoxygenated blood comes into the right atrium from both superior and inferior vena cava, then this deoxygenated blood goes into the right ventricle, and then from right ventricle it goes into pulmonary artery. But now since in lungs, that is the airways are blocked, so therefore that these lungs don't accept the deoxygenated blood, so here coming into the lungs from the pulmonary artery. As a result, so see that the reverse back of this deoxygenated blood into the right atrium occurs. As a result, you can notice that in right ventricle, so here that is a reverse flow of that is deoxygenated blood comes, and also that is the blood flow from the right atrium comes. So due to this, so here that is in right ventricle, that is the blood pressure increases, and due to the increase in the, so here blood pressure also, that is right ventricular hypertrophy also occurs. And you also know that, and in this case the main function of right ventricle, that is to transport that is deoxygenated blood from heart to the lungs, is also not done, as these lungs not accepting the deoxygenated blood, and this deoxygenated blood again return back into the right ventricle. So therefore the function of right ventricle is also obstructed, and due to the reverse flow of deoxygenated blood and again the flow of deoxygenated blood into right ventricle, so here blood pressure in right ventricle increases, and as a result, so here right ventricular hypertrophy occurs, and also right-sided heart failure occurs, and this right ventricular hypertrophy leads to increased size of heart in the chest way. So this is the main reason. So see what I written. So the explanation as a clinical features, the first one is the persistent cough. So here irritants cause inflammation of trachea and bronchi, and this inflammation, so here leads to excessive mucus production, and this excess, so here mucus try to get expelled by the body. So this is the main. So and due to this also cough occurs continuously, and in some patients also throat clearing action also observed. So this is the main reason of the persistent cough. Now let's discuss about dyspnea. As I already mentioned that dyspnea, that means difficulty in breathing. And why does this occur? So see that due to excess mucus in the lumen of the trachea and the bronchial tubes, the lumen is obstructed. So therefore the air pathway is blocked or affected. So therefore that is dyspnea occurs. So persistent cough and dyspnea I have explained. Now let's discuss about right heart failure or enlarged heart on X-ray. So see. So first I explain you about the normal function. Yeah. So the normal function of the right side of the heart, if you see that is to receive deoxygenated blood from the super and inferior vena cava, and then to transport this deoxygenated blood from the heart into the lungs through this pulmonary artery. That is the main function, is to transport deoxygenated blood from the heart into the lungs through this pulmonary artery. So this is the main function. So see that, so that this function I have written there. So here normally deoxygenated blood transports CO2 from right ventricle to lungs through pulmonary artery. As you already know that this deoxygenated blood, that is transports CO2 from right ventricle to lung through pulmonary artery. And the main function of right chamber of heart that I have explained, that is to transport that is carbon dioxide and deoxygenated blood from heart to lungs. See, so once again, so from here, that is right chamber of heart transport deoxygenated blood and CO2 from this heart to lungs through this pulmonary artery. So this is the main or the normal functions. So now let's discuss about chronic bronchitis. So as you already know that in chronic bronchitis that excess mucus production done in the lumen of bronchial tubes and trachea, and this excessive mucus production so affects the air pathway, or that is obstructs the air pathway. So as a result here gaseous exchange is affected. Now and see that due to this problem in the gaseous exchange in alveolus of the lung does not accept deoxygenated blood from heart. So as I already deoxygenated blood comes, but in case of chronic bronchitis, as you already know that the lumen of the bronchi and trachea block. So due to this obstruction, that these lungs don't accept this blood, so that this reverse back of the deoxygenated blood again goes, so does not accept. So that is what I have written, and this again deoxygenated blood here returns back to right ventricle, and in right ventricle from this side also pressure comes. So due to this also blood pressure increases in right ventricle. So see that. So pyruvate gases exchange, so lungs don't accept, so deoxygenated blood from heart, so deoxygenated blood returns back to, so here returns back to heart, so the transport of carbon dioxide and deoxygenated blood from heart to lungs not done, so therefore the function of right chamber of heart is affected, so therefore that is right sided heart failure occurs. So this is the main reason. And now see that, so due to this a reverse flow of some amount of deoxygenated blood into the heart, the blood also goes back into the heart, and the blood pressure in right ventricle also increases, and this leads to abnormal increase in the size of right side of heart, and this leads to enlarged heart found on X-ray. So this is the main reason. Now again, what is cyanosis? So that cyanosis also occurs, as I mentioned, that in chronic bronchitis breathing difficulty occurs, and due to this also less oxygen supply to the blood and tissues also, so therefore cyanosis occurs. Now about the A, so here recurrent respiratory infections occur. Why? Because of the bacterial, virus or mycoplasma attack. So let's discuss the definition of chronic bronchitis. So first of all, that as you already know that in chronic bronchitis cough occurs now, and also along with cough also sputum also occurs. Why sputum occurs? Because of the excess mucus production done in the lumen of the bronchi and trachea, and the body tries to get rid of this mucus, so therefore there is some amount of excess mucus also comes out, so therefore along with cough and sputum occurs because of the coming out of this mucus. And then this cough along with sputum production should be done for at least 2-3 consecutive months, at least 3 months, and along with 2 consecutive years. So this is the main definition. The definition, so here see that persistent cough along with sputum production for at least 2-3 months and at least 2 consecutive years. So this is the main definition. So see, so today I discussed about the causes of chronic bronchitis, and next about the pathogenesis. So this is the main pathogenesis, and this is the microscopic features, and these are the clinical features: dyspnea, and this is the right sided heart failure, enlarged heart on X-ray, and finally discuss about definition.